is Dr. Zia from Srinagar talking about latest updates in the hypertension. Now, to introduce it, as per the WHO, nearly 63% of total deaths in India are due to unrecommendable disease, of which 27% are attributed to cardiovascular deaths, which affect 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for CVD. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. Now let's discuss it. In India, the prevalence has also gone up in last 30 years to 38% in men and 32% in women, from 29% and 28% respectively. This is a report from the WHO. Despite that, nearly half of the people, or 51% of men and 41% of the women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get the treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. This is the Lancet reporting 2021. Now, international study of the hypertension has released the ISH 2020 Global Hypertension Practice Guideline. The inclusion of optimal and essential treatment paradigms attempt to address the issue that in resource-poor settings, optimal care refers to evidence-based standard of care, and where as essential standards refer to the minimal standards of care to allow specification of certain essential standards of care for low resource settings. Number 2, the American Hypertension and ACC has released a scientific treatment in 2021 offering new guidelines for management of the stage 1 hypertension among patients with low ASVD, CVD risk. Among the low risk adults, no ASCVD in 10 years' time. CVD risks less than 10% with age 1 hypertension. Blood pressure 130, 139 from 82 down, diastolic 80 to 89 millimeters of mercury. Management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, considerably standard pharmacological therapy, hypertension, acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19, which we are suffering for the last 3 years. A recent study, which appears in the Journal of the American College of Cardiology, reports that metoprolol can produce lung inflammation and improve respiratory functions in people with COVID-19-induced ARDS. Lowering systolic blood pressure targets down to 130, less than 130 millimeters of mercury range substantially reduce cardiovascular adverse effects in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients aged between 60 to 80 in China, the intensive target trimmed 26% of the complete CV risk. Findings from now a second major trial supporting a lower target could unite the guideline, and which events among U.S. professional societies range from a threshold of 130 to 150 millimeters a month. With regard to the prognosis, value of the ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of the essential hypertension recommended that the diagnosis of the hypertension should not only be dependent in-office BP measurements, but also out-of-office measurements, such as ABPM and home blood pressure monitoring device, which requires 24 hours of blood pressure after every half hour, or home blood pressure monitoring machine for 24 hours. And nighttime BP measurements were associated with greater risks of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimation of cardiovascular risk. For every 20 by 10 millimeter mercury incidence of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. In 2018, European guidelines equally recommended 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control, especially in the context of the low BP targets. To start antihypertensive therapy with an initial dual fixed dose combination like ACE inhibitors and ARB plus calcium channel blockers. Since early 2018, products containing valsartan have been recalled worldwide. The reason is the detection of the known carcinogenic effects, namely N-nitroisonyl methylamine, losartan, olmesartan, valsartan. NDMA has been classified by the WHO International Agency for Research of Cancers to be carcinogenic in humans. If 100,000 patients would have received NDMA contaminated valsartan from Zhejiang Ohio manufacturing site where the highest level of contaminants were found. Every day for 6 years in the highest dose, it would result in 22 additional liver diseases, liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 100,000 patients if they had taken their highest daily dosage for 4 years.